Our first order of business is to review and approve our agenda that was sent to you by Krista a week ago today. This is for today's meeting, November 17th, 2023, and I will entertain a motion and a second to approve.
So moved. This is Leanne Tucker.
Thank you. And Jacqueline, I see your hand as second. All those in favor, please indicate so. Any opposed? All right, we will move forward with the agenda. In accordance with State Government Ethics Act, it is the duty of every board member to avoid both conflicts of interest and the appearance of conflict. Our next item of action is to review and approve the October 2023 board meeting minutes. Again, these were included in your packet that Krista handed out, that Krista emailed, and this was our October meeting where we were in person. Dan, I see your hand raised.
Yeah, so I was just reviewing the minutes, and I would like to make sure that the minutes included in the section on the discussion for the wait list for the adult services, adult placement waitlist policy, that we actually did have quite a robust discussion about this, and the minutes don't really reflect that we had a discussion of concern and understanding of what this means, that this is a valuable asset to the community, and that we wanted to support that, and we were going to get follow-up on whether or not this wait list actually became problematic, that we were going to get some follow-up information after this went into place. And I just thought that the minutes should reflect that.
Don't do that, but yeah. We'll do. Thank you for that, Dan. We can go back to the recording and, well, actually it was in person.
Yeah, that's the recorded it.
Okay, and we can make that revision to reflect the robust discussion. You did bring up a question about follow-up, and since I wasn't at the meeting in October, is there follow-up around the wait list?
I think it would probably need to be longitudinal, where once we implement the policy, we can track, like, is the wait list growing? Is there a need for a wait list? How is it being impacting our community? Because I think one of the things the board was really good about was saying, do we need to look at maybe staffing this differently? So if we could, like, track the impact of having a wait list over time, it would then allow us to see whether we needed to staff it differently. Dan, am I saying that correctly? That was a quick summary of...
Yes, correct.
So Krista will make those changes in the agenda. I'm sorry, not in the minutes, sorry. Are there any other revisions that need to be noted? So is there a motion and a second to approve the minutes with the amendments that Dan is suggesting?
I'll move with those edits. Yes.
Thank you, Dan. Is there a second?
Second.
Thank you, Yvette. All those in favor, please indicate so. Any opposed? All right. So thank you all. The minutes are approved. And we will move on with the agenda with presentations and updates. And we will begin with summaries from our program committees. And Dick will begin with you with the Health Committee.
Okay. Ellis gave us a nice presentation. Our public health division obtained quite a bit of money from the federal government, particularly the CDC, from the pandemic payments that are earmarked to last for 4 years, and it went from the federal to the state, and the state sent Buncombe County its share. The purpose behind this money, or windfall money, is for workforce development of the Division of Public Health and infrastructure. And Ellis has been trying to formulate a plan, which she explained her rationale behind this plan, which is going to be particularly to train new and existing staff, to develop some academic liaisons with UNC and UNCA, to form an academic health department designation, and also to further support and sustain staff. Once she finishes in her mind how the money is going to be appropriated for the next 4 years, she's going to present her plan to the Board of Commissioners, because she needs their permission to spend the money. And she's planning on this presentation, I believe, in January, she said, but she's very excited about this because it represents many thousands, hundreds of thousands of dollars to help strengthen our department.
Questions, curiosities, comments for Dan and Ellis and the rest of the, not Dan, I'm sorry, Dick,
Okay.
Ellis, and the Health Committee. Well, thank you all so much. And now we move to Dan and Rebecca with the Safety Committee.
Thank you very much, Lucy. We had a nice discussion and follow-up from Rebecca about many of the active issues and tension points. So it seems like in general, there's a lot of positive elements that are moving on these areas. We want to highlight that workforce recruitment, retention, resiliency is still going to be a priority, but there seems to be positive movement in the plans for the county and the compensation analysis. And we just want to continue to keep that on the agenda and not get lost as these developments happen. And hopefully a long-term solution is finalized by the time the new budget is approved in the late spring. So that's positive. So the other positive elements is that the foster care capacity continues to be a stressor, but there seems to be an opportunity that is happening of a new facility of 20 beds that may be beneficial for kids with more intense behavioral health needs. And so there seems to be some positive movement in partnership with VIA and some other organizations. So that's also a positive development. Rebecca is working on a whole bunch of areas that we've reviewed. With the whole gamut of services, we decided that in January, we're going to be focusing and really digging in to a bit of the data. Once we have a whole year of data of the court data and equity and racial data around service deliveries. And that's where we're going to spend some of our time in the beginning of the year. Rebecca, is there anything else you'd like to share?
I think you covered it all. Thanks, Dan.
Are there any questions or curiosities for Dan and Rebecca? I appreciate the committee kind of diving into this and being a support for Rebecca and her team on this continued stressor. So now we move to the Opportunity Committee, Martha and Philip.
Hi, everyone. We had quite a fire hose tsunami update of a meeting with the Benefits or Opportunity Committee, because everything seems to be aligning on December the 1st, from Medicaid expansion to all of the energy programs opening up. And already, Philip, we talked about workforce as well, and it's going to be a tremendous issue for the benefits folks. They had their record number of calls at the call center last Monday. And they anticipate that they're going to, at the end of this year, they'll have fielded 180,000 calls just for energy. And their staff, one of the issues for the benefits folks is the difference between hired staff and trained staff, because I think we all know that you can't just fling somebody into a situation where there are complex federal and state rules, many different types of applications, many different types of requirements, and expect them to get it right every time from the beginning. So it takes months to train benefits workers. And this is one of the issues with workforce for benefits or opportunity. Energy is getting ready to kick in big time. That's usually between December and March. And there are 3 different programs that they have to work people through: crisis intervention, emergency assistance, and LEAP, the low income energy assistance program. And so that's extremely complex. Plus, Medicaid expansion. Now, the good news about Medicaid expansion is it passed, and we are going to have it in North Carolina and in our county. So big ups for that. But it is going to present a tremendous amount of work to try to get people who are entitled enrolled and connect them to services. Those were the major highlights. There's a tremendous amount of work coming to benefits and not enough workforce like everybody else. And there is no windfall apparently in the pipeline for benefits. So one of our questions is, well, how do we take a systems look at what's going on with benefits, not just talk about workforce, but all the other processes? We all know how complicated federal guidelines are and requirements. Are there ways to work within those, or to use technology and better ways to help keep the current record of the benefits folks as high as it is? And I'd just like to brag on them, because they have been able to complete over 95% of their applications in a timely fashion, where a county whose name I won't mention down the state, very big, and Raleigh, Duke, area, have only been able to complete less than half of theirs in a timely fashion. So again, major props to Buncombe County staff. We did have a question about a study that Philip mentioned, the STAY study that was done in the summer, Stoney, and if we wondered if the results of that could be shared with the board at some point. We also just want to do whatever we can as a board to help with these person power issues. Anybody else from our committee have any comments?
I'll add one thing, Martha, that I think is important about expansion. As of today, 5,600 residents in Buncombe County have already gone from a very limited Medicaid program, family planning, have already been shifted to full Medicaid effective December 1st. There's 5,600 residents have gone from very, very limited Medicaid program already to full Medicaid, and start to see the benefits of that in 2 weeks.
Yes, and that also takes some of the burden off of Buncombe County staff.
Absolutely.
Any other comments or questions?
Martha, thank you for surviving the fire hose, and just kudos, Philip, to you and your staff. This is a major undertaking, and the fact that we are already seeing over 5,000 families who are benefiting is tremendous, and I hope will be a beacon for us to see more and more families benefit from this. Thank you. We now move to presentation on land use acknowledgement by our own Dr. Martha Salyers, who has really, Martha, you've been so wonderful in helping to bring this to light for our board, and your insight and expertise is very important as we consider steps for our board. So we are turning things over to you, and this looks already like a beautiful presentation.
This will be brief, I promise. I have been thinking a lot about land and labor acknowledgements, and I've expanded this from just land acknowledgement to labor acknowledgement as well, and I'll explain that as we go along. Next slide, please. So what is a land acknowledgement? And there are a couple of definitions. It's a fairly vague, you define it as you want to type of term, but the idea is to formally recognize people and cultures who historically occupied and still occupy the place where we are. So it's a matter of looking back historically and looking around us in the present to make sure that we have acknowledged what others have done to make this such a beautiful and livable place for us. And the Native Governance Center says that usually these land acknowledgements take the form of written and or verbal statements, one of which you see as an example here. Next slide. But there can be other types of land. I just wanted to show you historically, speaking of history, what Cherokee territory used to look like back in the 1800s. The green swirl is the rough location of Buncombe County and Asheville with the little arrow pointing to it. And that territory was Cherokee territory, a couple hundred years ago. Now, if you look to the left of the Asheville-Buncombe County designator, you'll see a very small area that's kind of olive green. That is the current Cherokee lands. And that leaves out a few lands that are scattered through, yes, very good, thank you, through Graham, as far as Graham County, Swain County, Jackson County, but you can see the difference over history after many sessions and many broken treaties. Next slide, please. Land acknowledgements can take a lot of different forms, though. This is an example of an art piece representing Cherokee basketry in a public space. Next, please. And maybe you're familiar with the Indigenous Wall Project, which has put Salagi Ayeli, that means Cherokee people, pieces all over downtown Asheville. I'm sure that many of you have walked past them and seen them. So yes, land acknowledgement can take many forms. Next, please. You probably have heard that there's some controversy about land acknowledgements, that there are groups of Indigenous folks like the Association of Indigenous Anthropologists who have said, who have asked for a pause on land acknowledgements a couple of years ago, saying that there's really no evidence that acknowledgements alone lead to any kind of change. The Native Governance Center, which I mentioned a minute ago, takes that a little bit further and says that for acknowledgement to have meaning, it must be linked to action. And the National Museum of the American Indian in Washington, D.C. Also talks about land acknowledgements being motivated and involving respect and support. So collaboration, accountability, continuity, and respect as essential parts of such statements or such processes. Next, please. So you notice that at the beginning I said a land and labor acknowledgement. So there are land acknowledgements about the people, the Indigenous people who both lived and still live here, and who underwent a great deal of trauma, attempted genocide, colonialism, etc. Also, there is a large group of people to whom we owe a tremendous debt who built Asheville and who were and environs and who were subject to inhuman and oppressive situations themselves, and that specifically is enslaved people. Next, please. People, there are people who say, oh, there wasn't much slavery that happened in Asheville and Buncombe County in Western North Carolina. It was all those mountain folks, those Appalachians who were busy farming and, chiseling out a living in the mountains. But there definitely was use of prison labor, and there were definitely fairly large slaveholders in Buncombe County. This photograph is actually a colorized version of a photograph taken of prison laborers who were forced to put in the railroad that went through North Carolina. Many deaths, terrible working conditions, and unfortunately, this is a tourist postcard that you could send back to say hey to your folks when you were here visiting. It's appalling, but there you have it. And the inset is just to show that some of the most famous names in Asheville, names we all know, like Merriman, Chun, Patton, Weaver, Woodfin, who was the largest slaveholder in Buncombe, and Vance, all have major things named after them that we see every single day and say in our own mouths, that have echoes back to a terrible time in Buncombe County's history. So just to remember that, and to say that we owe a tremendous debt to the people who had to experience these, and to their descendants who live here today. Please give me the next slide. So why would we have a land and labor acknowledgement? The first thing, of course, is what we already talked about, a recognition of the history and the present and our role in it as people who enjoy the benefits of the people who came before us. And that's a way of showing gratitude for the sacrifices and for the trauma that those folks have gone through and still do. Fairness, obviously, we're talking about justice here, and even just acknowledging the debt that we owe is a way to promote fairness or justice. It also is an opportunity or a springboard for dialogue, partnership, and I use the word reparation here not as talking about the reparations process, but for financial repayment for harms done, but as a term to say that there are things that are owed, and we may not think we personally owe anything, but we as residents of Buncombe County and as members of the Board of Health and Human Services should be thinking about reparation. And I think we do a pretty good job of fostering and supporting that in the Health and Human Services. But let's put it out there and say that we do. Now, it would also promote consistency across county government, because this isn't sort of something that just came out of nowhere. We already have an extremely powerful exemplar in the Buncombe County Register of Deeds. Could you go to the next slide, please? Oh, yes. And this is just to say that the population in Buncombe County is changing fast. As we know, this is the little gray dots are what the population, various populations were in Buncombe County in 2012. And the larger colored dots are those of in 2022, which is the most recent U.S. Census data. And you can see that there have been extreme changes in Hispanic and Latino populations, in white non-Hispanic populations. The African-American population has stayed pretty much the same, and other populations have not changed a whole lot, but every population is going up. And the changes in population, even if you look at American Indian Alaska Native, there are about 1,000 residents of Buncombe County who are American Indian Alaska Native, which is less than 1% of the population, but just goes to show that people are here and still here. And even if the African American population has not increased, people are here and people have needs. I won't go into what multiracial means or how that makes it more difficult to interpret numbers of population or percentages of population. I think we all know about that. Okay, next slide, please. So this is if you haven't visited this website, I highly recommend it. It's a sub-site of the Register of Deeds and is a very comprehensive examination of the history of Cherokee land cessions. And of course, the Register of Deeds would be a logical place to do this because that's where all the deeds and all the real estate records in Buncombe County back to hundreds of years ago get stored and are available for examination. And so they did a very deep dive into Cherokee land cessions when they were looking into how Buncombe County came to be. So please visit this, and I think use it as an example. And when you go there, first thing you will see their land acknowledgement statement. And next slide, please. And actually, the Register of Deeds, in cooperation with the Center for Diversity Education at UNCA, also did a very deep dive into slave deeds, enslaved person deeds, which there are many in the Register of Deeds office, and used that information as a springboard to talk about the history of enslaved persons in Buncombe County and to take responsibility for that history and move on from there. So I think that the Register of Deeds has done a great thing, but that's not the county. That's only one agency in the county, and I would like to propose that we use them as an inspiration in dealing with this question of land and labor acknowledgements. We did have a conversation with Drew Reisinger, the Register of Deeds, which was very helpful, and he very much supports the board proceeding with this, if we so decide. Okay, next slide, please. So you'll notice that I didn't give any examples of land or labor acknowledgements because I'm not here to be prescriptive at all, because I don't have expertise in this. I'm just another board member who wants to use this as a lens to look at what we do and show everybody in Buncombe County that we understand where we come from, even if we're not from here, and what we owe the people who are from here and were from here. So I'm just proposing that we consider this, creating a land and labor acknowledgement, creating a process to do it, and accompanying that with action steps, not just having a performative statement on our spanking new great website, but actually talking about how we can make this a living project and a living partnership and collaboration opportunity. So it would be up to the board to decide whether to do this, and the first step would be to explore what it would mean to do it and who would need to be involved. And I thank you for your time and for the opportunity to address everybody. Are there any questions or comments? Thank you, Krista.
I would like the opportunity to have your presentation, and it may have, I don't know if it was sent to us, to just to click on the links and be more expansive. And because I haven't been to the Register of Deeds to actually sit and explore. I am going to take Drew Reisinger is just amazing, and he has also done the Green Book, and there's an exhibit at the Wesley Grant Center, and I don't know if today is the last day. I'm going to try to shoot down there and see that between meetings, but I would like to be able to read the links because I haven't explored this but I know it's been there. I know it's available. But having those links, I would be appreciative of that.
Sure. Chris, if you could send that out to folks who might be interested, that would be great.
I'm doing it right now.
Thank you, ma'am.
You're welcome.
Thank you, Martha.
Thank you, Jackie.
Jacqueline, thank you. And Dan, your hand is up.
Yeah, thanks so much, Martha. That was really, really a valuable learning session. And I really appreciate this idea. I can't turn my camera on. I don't know why I lost permission for some reason. But so one question I have, I've thought about this land acknowledgement. I think it's really, really important that I think it's a great idea. I think we should do this, but it's really important that it comes with some action of what it means to the county Health and Human Services. So I'm wondering, is there any precedent or guidance on who the partners are in that? I mean, is there a Buncombe County Native American Council that would be a part of this? Is this something that we would reach out to Cherokee and the Cherokee Indian Hospital and say, hey, we as a Department of Health and Human Services in Buncombe County would like to do this. Will you partner with us on what this would look like? Is there precedent of doing it that way versus us just trying to think about doing this?
Yeah, I think those are really important questions because doing a land acknowledgement is for us and by us, because it's about our acknowledgement. It's not about getting somebody to come in and do it for us, but it's about creating partnerships so that we know what that means. For example, if we went to appropriate people in the Eastern Band of Cherokee and they said, no, we don't want you to do that. It's meaningless. Even if you do it with actions, it's meaningless. We would say, okay, we understand we're not going to do it. But I don't think that's going to happen, but there are multiple different points of contact in the Eastern Band of Cherokee Indians, and they're only an hour away from here. So there isn't necessarily a Buncombe County, branch or consultative group. And it would be easy to find those folks in the Eastern Band.
I do know that UNCA has done this. At the graduation, yes. I went maybe a year or two ago. They have incorporated that, and I'm wondering what the process they went through to do it. I mean, they're a pretty visible, pretty big institution in our county. Might be helpful, as you listed in your resources. Their Center for Diversity Education is, and Darren Waters is no longer there. He's at the state level, but I'm sure he would participate and give us insight on how they went about doing that. That might be another first step or something.
Yes, I think the UNCA folks, Trey Adcock is is on the faculty there, is an Eastern Band member. There are multiple people here who could be helpful. I think that would be part of the process of a committee or group that might do this as a subsection of the board.
Western did that too.
DK, you have your hand raised.
Yes, for some reason I can't turn on my video. Sorry. Yeah, I just have a question for clarity for the general public, because it's not completely clear to me what you're Martha, what you're proposing that the HHS board do. Can you just provide a little more clarity on what that looks like?
I'm proposing that the board start a process to determine whether we want to have a land and labor acknowledgement statement on our portion of the Buncombe County website and our new sub-website that will express the things that I talked about in a land and labor acknowledgement, and to accompany this with looking at what the board does currently to see how effectively we live that and other means that we might use to do better. Does that
Okay.
help?
Yes, so it's land acknowledgement on the webpage, and are you also proposing like at the start of your meetings? Or you hadn't
That would
done
be
that?
up to the board.
Okay.
Hey, Martha, this is Kurt Euler. I'm curious, do you know of anybody that's done one of these land and labor acknowledgement agreements? Just so I could possibly look and see what one actually looks like. I have to admit, I'm a little not really up on that.
Yes, well, you could look at the Register of Deeds, and you could look at Fitchburg State University, which is in the references in the slide presentation. And there are numerous universities and other folks who
Okay.
have done that.
Okay,
Western
thank you very much.
Carolina, as I mentioned.
Mm-hmm. Western. Mm-hmm.
And Martha, if I may, St. James Episcopal Church has just gone through this process of land and labor acknowledgement. And Kurt, I can get you that information. I've been on a committee that has been working on this.
Right.
Well,
there,
I just, as I said, I just haven't ever seen one, and
Sure. Sure, and there are lots of examples. There are very brief ones, and then there are very long ones. It's really completely customizable
okay,
to your
great.
situation.
Thank you all.
So Martha, what you are asking, you have two questions for us as a board. What would it mean for us to move forward with considering a land and labor acknowledgement for the board? And then the second question is who would be involved? So I want to open up those two questions to the board for discussion on how we might move forward.
Well, I would just say to look at what others have done and to look at the procedural processes. I mean, we can look at the ones that Martha has outlined in Buncombe County, but there are others in Western North Carolina that's done it as well. I guess as a board, we would have to, or maybe should vote to say, is this a direction that as a board that we want to go in, and is it this board, and would it just be for this board, or would it have broader implications in the county?
That's a good question. Has the commissioners ever talked about this? No, they haven't.
Stoney and I were just passing notes about this, and we, to our knowledge, and Martha, you may have a different take, but it seems that it's just the Register of Deeds with Drew providing the leadership for that. And from what he explained in our meeting, it was relevant for his office because of how persons and lands have been owned historically in our area. And I think that we as a Health and Human Services Board could take a parallel perspective on how systems and structures have existed previously in health and human services that have been exclusionary and that have been exploitative. That's kind of what I am thinking in terms of the necessity for our board to explore this. And Martha, I'm just looking at you because I didn't know if you had a different take on that from the meeting as well.
I do think it's critical to know where we come from. There's an enormous amount of information that we already have about both about indigenous and enslaved persons in this county. So looking at it from a health perspective, health and human services perspective, I think could be done. It could be part of the purview.
Martha, this is Craig. In addition to acknowledgement, which is action, you said that we should also consider taking further action other than acknowledgement. Can you give us some examples of what that might look like or what other people have done?
Yes, I agree that acknowledgement is an action, but it can be perceived as performative if people just do it and then quit there and just have something nice up on their webpage. So yeah, the idea is to analyze where we come from, what are we doing now, and what can we do to make even more of a difference. Your question was, are there examples of how other people have done it?
No, examples of what further action beyond recognition should be possibly considered.
Sure. Well, you may notice that the photographs that I included were all in Buncombe County and are actions that people have taken. The Indigenous Walls Project was a way to educate the public and the people who come here on the history of the Cherokee people and that they're still here. There has been a lot of work, for example, by the Center for Diversity Education of traveling exhibits to educate people about both indigenous and formerly enslaved persons. Other actions, I mean, there's a long list, and I don't think that's my place to say what might be done, but if I can just give a single example that's happening as we speak, the new Secretary of Health and Human Services of the Eastern Band is visiting Stony. So Stony has already reached out and as in partnership to the Eastern Band Health and Human Services. And I think that's kind of a preemptive action that he'll figure out what partnerships they can build and what collaborations and what concrete efforts can happen here between Buncombe and the Eastern Band.
So, I agree with you that recognition is an important first step in doing something to further recognize and take action. And so I was just thinking, if as a board we are to both recognize and then to create an action step, what possible things could we as a board consider doing? And maybe it's a sponsorship for another action in collaboration with another organization or what have you. And I don't expect you to know all that, but I was just thinking in terms of your proposal and thinking about that as a board, how can we creatively think about actions taken that would support the recognition?
Mm-hmm. And I think that's part of the process of exploring this and creating it.
Mm-hmm. And Drew may be, since he's done so much work, he may have some ideas, that could be shared with our board, because he's been doing a lot of work for this for years. Like I said, when I leave this one, I'm going to see the exhibit down at the Wesley Grant Center on the Greenbrook. And so with the extensive work that Drew has done, he may have some suggestions or recommendations.
I'd say one practical thing that we've done, which is not necessarily a land acknowledgement, but it's a cultural acknowledgement, is our social work organizational care model, which has gained attention across the state. We've taught it across to agencies across North Carolina. Really, when we developed it, a key component, a key feature of that was developed off of the Native American medicine wheel. And so we acknowledge that. We take, every time I've ever heard that trained, we take time in that training and acknowledge that that cultural richness and that contribution to how we care for our staff. And so sometimes I think it's just something as simple as that, back to what Martha said, and it's not just an acknowledgement, but it's also, you know, a use of that to make life better. You know, so like I think that as a human services agency, there's probably acknowledgments we might make that maybe the Register of Deeds wouldn't because of the specific space we're in around, you know, helping people culturally and their human condition and things like that. But I just throw that out there as a thought and as one way that we do acknowledge our Native American influence in health and human services.
What I would like to suggest is if the board would like to consider developing an ad hoc committee that would be willing to explore what this would mean and what it would look like for our board. So I put that out there for discussion and seeing what's the pleasure of the board.
Well, I would second that and would be delighted to serve on that sort of ad hoc committee.
And I would like to serve on that ad hoc committee as well.
But first, the board has to decide whether we want to do it or not.
Yep. And I would entertain volunteers at the same time.
Can I just make a suggestion that maybe what you want to do is use the committee to determine whether you want to move forward on this issue. So Lucy, as the chairman, you would appoint a committee. That committee meets, then brings a recommendation back to the board, and then the board could feasibly then take action on something a little more concrete.
I'm so glad you're here.
Well, no, I would also appreciate too, is that I would be happy to help when you all meet too. I just want to make sure that we are staying also within our sort of guide rails as a board, and making sure that we're complying with 153A-77. So I just want to make sure that we're doing what we are supposed to do, and, you know, not jumping into something rather quickly. So I would just like to make sure that we take positive steps moving forward, but also make sure that we're okay with everything going forward, or at least that would be my recommendation to the board.
I agree, Kurt.
That sounds really good. And DK, I appreciate your comment of if we do develop an ad hoc committee to consider reviewing the racism as a public health crisis declaration that the board passed and the included actions in that, and to also consult with the County Equity and Human Rights Office. So, Kurt, help guide me here. Do we need to take a vote?
No, I think under the powers and duties as chairperson, you have the ability to appoint a committee. And
Okay.
then I would just say, appoint a committee and then say, let's bring this back. And then maybe give a timetable as to when you would like to see this issue back.
Okay. That is what we have done. Martha and I have both expressed our interest in being on this ad hoc committee. Amy, thank you so much. And if there are other folks, we definitely need as many different voices and brains around this as possible. So please just let us know. Is there anything else we want to discuss about this? Martha, are there any final words that you have?
No, thank you. And I thank the board for your input very much.
Thank you so much for your leadership. All right. I am moving on to old business. If there is anything to, oh, whoops, sorry, naloxone distribution. Mitchell, I see you. Glad you're here.
Thanks, and thank you all for having me today. So my name is Mitchell Albers. I'm the Harm Reduction Program Manager with HHS. Stoney just asked that I drop on the call today to be able to give a brief overview of how residents as well as organizations out in the community can gain access to naloxone through HHS. So as most of you know, we operate our syringe service program here at 40 Cox Avenue. We're co-located in HHS building downtown. So individuals are able to come in to our program Monday through Friday, 12 to 4. And so individuals can be either active, ongoing participants of our program or a one-time visit from a community member. So folks are able to come in and access both intramuscular and nasal naloxone, as well as other safer use supplies, harm reduction supplies, such as fentanyl and xylazine test strips. Everything we provide through our program is free of cost to participants and residents of the county. So we don't take any identifying information for participants. It is good to let folks know. And people are able to use this service as frequently as they'd like, whether that's one time or we have some participants that come through almost daily. When it comes to requests for more than individual supply, we are taking these on a case-by-case basis just to ensure good stewardship of our programming and opioid settlement funds. So that said, we are generally able to support requests from nonprofits, partner agencies, those that we collaborate with in the community ongoing that are doing this work out in the community, as well as internally for those that don't have budget access for naloxone necessarily. So we also do supply kits to naloxone kits to participants of our trainings. So right now we routinely hold a standing community training at HHS the first Fridays of the month. So that next one will be December 1st. We do that at noon at the main level conference room, right when you walk in the main entrance of HHS. We also frequently take requests for training out in the community. So whether that's at bars, restaurants, venues, colleges, really anything in between, and making sure we take time to cater that learning material to the audience. So just wanted to kind of give a brief overview of how folks can gain access to those services. And if there's any questions, I can drop my information in the chat and make sure that we can talk individually.
I have a question, and thank you for that information. I'm retired from Mayhack, and we used to have people that come through, and I would get the vial. I don't know is it a vial or injection, but that would save someone's life. And I had it, get it for 4 years, but I've never had the been blessed not to use it, but I guess I was in either the wrong place at the right time or the, the other. And so I hate to take it and never use it because I may not be there. And so what do you recommend if we, as a board, we're always talking to people and saying these resources are available. Realistically, who should carry that to be able to help? I don't want it just to say, I've got it, and it continues to expire.
Sure. And I appreciate that. And so what you're describing with the vial is the intramuscular naloxone. And if you're comfortable carrying that, it is actually a much lower price point for us. It's about $3.37 for a vial versus $37 for the nasal spray. But what I tell everybody is if you're comfortable and able to carry it and have the know-how to use it, should definitely encourage you to carry it. We haven't run into a point yet. I've only been here a year in this role, but we've not run into a point yet where we've run out of funding to be able to supply this medication to folks in the community. So, I would fully encourage you, if you're willing and able to carry it, and we can get that to you free of charge.
And you do the trainings as well.
We do. So we hold the monthly standing community training, and then we take individualized requests. So we're going out to UNCA in a couple weeks. I was at Warren Wilson last night. So yeah, anybody who's interested in having our training, making sure we can get, the general public trained up. Martha?
Hey, Michael. Mitchell.
Yes.
Mitch, thank you so much for this presentation, for what you're doing for harm reduction in Buncombe County. Does WNCAP still have their program, and do you work with them, and are there other entities in the county that are also doing harm reduction? And what's your relationship with them?
We have positive relationships. So there's 4 total groups that are doing what we would call SSP work. So WNCAP is still very much active. They'd be fine with sharing this, but they had some issues with their physical building as of recently. So they've not been able to access some of their supplies. We've had a bit of an influx in participants coming to our program as a result of that. So we do just kind of have some reciprocity there, and we all talk back and forth. And then there's Steady Collective that has historically been in our community. I think they've been operating at a bit of a lower capacity. And then there's Holler Harm Reduction, and they only serve the northernmost part of Buncombe County. Largely, they serve Madison County. But for us, they serve Marshall and the areas up north in our county. But yeah, we have good working relationships with everybody else doing this work in the community. So those are our primary folks that have syringe service program work. But then we also are working around partnering up and propping up organizations like UNITE, Emoja, Operation Gateway, working with folks that aren't necessarily primary doing the SSP work, but are involved in having community health workers and peer supports that are really champions of harm reduction.
Thank you.
Thank you so much, Mitchell.
Thanks. I'll put my information in here, and hope you all have a good day.
Appreciate it.
Thank you. And it'll be in our meeting minutes.
Indeed. All right. Is there any old business?
Hey, Lucy, I'd like to circle back to some old business. This is Savannah.
Great. Go ahead, Savannah.
Yeah, I'd like to circle back to our workforce shortage issues. I know that we have shortages across the board in all the departments, but I think that the board should take special interest in the child welfare shortage issues. These kids, they're our largest minority group. Like our Buncombe County kids are our largest minority group, and they're not represented. They don't get to vote. They can't call us to tell us we're not doing our job right. It is our responsibility to take care of our kids in their homes. I have the Buncombe County website up right now, and it says North Carolina law requires that local county departments of social work services ensure children's safety in their homes. And I just want to think about that statement. It is our responsibility to ensure children's safety in their homes. This is a really complicated matter. Philip shared an article with us during our small group saying that we're going to suffer from workforce shortages in the US probably for a decade. We've already been short-staffed for a year in CPS, and we just need to start thinking out of the box, because it's just not acceptable to have our children not being taken care of, right? And also for our caseworkers to be so overstretched, that's not okay either. So I'd like to entertain people's ideas and just encourage us as a board to really keep the child welfare staffing issue at a forefront. Because the kids, they can't call us to complain. They can't call us to tell us to do better. So we need to have that on our radars at all times. Thanks.
Thank you so much, Savannah. I definitely think that this is something that the Safety Committee continues to address, and I know that Rebecca is working hard with her team to address this. I appreciate you bringing this up and highlighting the vulnerability of the children who are in custody, as well as the staffing issue that is a challenge in us as an agency being able to fulfill our mandated role.
Something positive I could share.
Stoney's going to share something positive.
Yeah, so I do have something positive to share. So our strategy and innovation department has really been critical in helping us think through this shortfall and this challenge strategically. And next Monday, I believe it's Monday, I have to look at my calendar, Tuesday, we're actually going to have a meeting with our county HR to talk about next steps and strategies in terms of sustaining a viable child welfare. And that's happened since our last board meeting. So I just did want to share that good shout out that our HR department is meeting with social work leadership next week to talk about, next steps in a long-term solution for this problem. So that's really, I think, positive, and I did want to share that with the board. So thank you, Savannah, for actually bringing that issue up.
Thank you for letting me speak.
Yeah. With new business, we have a recommendation for a new board member. Last week, Greg, Johnny, and Linda and I, as the exec committee, met with Stephanie Stewart, who has submitted an application to be our newest member on the Health and Human Services Board. Stephanie has a bachelor's degree in health science and wellness from UNCA, a master's of public health from UNC Chapel Hill. She has a graduate certificate in gerontology and is completing another graduate certificate in health informatics and analytics that she will complete in December 2024. One of the aspects that makes Stephanie a great candidate for our board is that she was previously a client of Health and Human Services while she was raising her family. Stephanie is very transparent about her long-term recovery. She is currently employed at MAHEC, where she works in systems supporting health and well-being of individuals and families who are experiencing complex social, medical, and or behavioral health conditions. At MAHEC, she creates and is launching the provision of tailored care management for tailored plan Medicaid and Medicaid direct members. Previously, she has worked with Land of Sky and with the YMCA. And we believe that Stephanie will be a great asset to our board as Buncombe County is rolling out our Medicaid expansion. So I would like to see if there's any discussion on this nomination, and I see Dan's hand is raised.
Yeah, hi, I can just quickly vouch. I've worked with Stephanie Stewart when I was at MAHEC, and she's currently attending the Safety Net Committee for the county, which I'm currently chairing. I vouch for her. She would be a great addition with all of her lived experience, her skill sets, and her integrity. So I would totally vouch for her.
Thank you for that, Dan. I will entertain a motion and a second to support Stephanie's nomination to the Health and Human Services Board that will then go to the county commissioners.
I'll move.
Thank you, Dan. Is there a second? Thank you, Linda. All those in favor, please indicate.
Aye.
Any opposed or abstaining? Thank you. We are very excited to take Stephanie's name to the commissioners. All right, Stoney, it's you.
Okay, so I just wanted to update the board on our ongoing support in advocating for increased limits for energy assistance in North Carolina. So after our last board meeting, and just to catch up with the folks who may not have been here last month, our board advocated for an increase in the limits for the low-income energy assistance program as well as the crisis intervention program. They've been the same amount for probably 20 years in our state. And given the high cost of heating and cooling and also the very difficult financial challenges that many people are facing, we thought it might be time for that. The good news was that the legislature did pass increases in allowable increases in these programs. They currently sit at $600 a year in each program, and the legislature said that these limits could actually be as high as $1,000. Unfortunately, they did not include any additional funds for those programs, and so the Department of Health and Human Services has been a little bit hesitant to raise the limits. I did, however, was able to talk to Carla West, who is the Deputy Secretary of the HHS and over the Division of Child and Family Wellbeing that administers these funds, and we had a really good discussion, and we just talked about it from sort of a practical perspective. And a couple of things that's interesting is just last week, I believe, everyone who got a low-income energy assistance program check or crisis intervention last year received an additional $287. Okay. So my point to them was, well, we're sort of already doing this. So like we clearly had money left over last year, and now we're giving it to people this year. So my idea back to DHHS was, each year, if you have an overage, could we just take that and divide it by the number of applicants, and then the next year come up with a different base model? It actually would save a lot of administrative time and cost, and it would allow people to get their energy assistance much sooner. And so, the good news is she was very open to that idea. So what it looks like we'll be able to do is DHHS is open to studying this and perhaps raising these limits, not this year, too late for this year because energy starts December 1st, but maybe raise the limits next year, at least incrementally, like maybe we don't go up to 1,000, and try to eliminate that overage, because I think their concern was we would serve less people. But in reality, we're not serving less people now. We're just giving people a little bump. And so I just want you to know your advocacy efforts are working. It looks like we may be able to pull this off in the next fiscal year. And so I just wanted to give that good news to the board. We'll continue to keep an eye on it at the staff level, and we'll see if we can raise those limits in next year's energy season.
Any questions for Stoney? That is exciting news. Thank you. So you're finished with your report.
Mm-hmm.
All right, so my chairperson report will be brief. Last night, our Health and Human Services Board hosted a film event at the Wortham Center for the Performing Arts. It was a screening of the film Veterans Battlefield about veterans in North Carolina. One thing that I learned from this film is that North Carolina is home to over 700,000 veterans and is the has the eighth largest veteran population of any state in our country right now, and has the fourth largest active duty population in the United States. Following the film, there was a panel discussion that was moderated by Heath Smith, Veteran Services Director for Buncombe County, and Rod Gilliam, who was actually highlighted in the film, was part of that panel discussion, as was Kevin Rumley, who is the director of Buncombe County's Veteran, what is it called? Veterans Treatment Court, yes. So we were very happy to host that event. Buncombe County was one of about 5 counties across the state to screen that film. Then I also want to bring up in my report that we will not be having a board meeting in December, but rather we are having a holiday meeting with no business, and that will be on Friday, December 15th, 11:30 to 1:30 at Cox Avenue. So please be looking out in your emails about information regarding this event, and hope that folks will consider attending as a way for us to gather together and continue to build our social capital as members of our board, to hopefully increase our effectiveness and productivity for the community. That is all the business that I have, and I am happy to entertain a motion and a second to adjourn our November meeting. Unless you
Nobody
want
wants to leave. We like it here.
Second.
All right, all those in favor, have a really good holiday and see you in December in person.
Bye.